Next speaker will be Dr. Pasquale Patrizio, the director of the In Vitro Fertilization Program and professor of obstetrics and gynecology at Yale University in New Haven, Connecticut, presenting on a candid assessment of social fertility preservation via oocyte cryopreservation. Thank you.
Thank you very much, Cara. And again, I want to thank you, Norbert, for the very kind invitation, and also David Albertini for putting together a nice program, and Zev and the organizer for such a smooth running over the meeting so far. So what I'm going to do in the next, probably I have a little bit more time, but let's say 30 minutes. First, I have two disclosures. One is here, the co-founder of Fertile Safe. The second one is that I have an accent, and I will have it for the duration of my talk. So what am I going to talk about? First is women's attitude. I mean, why are women freezing their eggs? Second, where do they get the information about freezing eggs, success rate, and how to do it? And also, the third point, which is important, is how effective it is, social freezing or elective oocyte banking. And the last point I would like to make is the surge of a new type of request that reproductive endocrinologists are receiving, especially in the United States, which is a request to cryopreserve egg or sperm in patient transgender that are ready to undergo body modification surgeries. So first is why women freeze, delayed motherhood. Like Dr. Kushner just presented to you, there is definitely a tendency for women to delay, postpone the time to pregnancy. In the United States, this was already demonstrated. You see that the age of first birth went from age 21 in 1970s to age 25 in the 2005. In Canada, the same. If you look at the Canadian report, the average age of a Canadian woman giving birth moved from 27 to age 30 in the last 20 years. Therefore, this advance, this change in the demographics, is posing some social challenges. And these challenges are, we need to educate women. Postponing fertility, yes, but how? Do they know that there is a reproductive biological clock? And if they do, who is giving them this type of information? And what is the quality of this information? The second is, okay, what type of sociological implication freezing eggs is bring about? So why do the women freeze the eggs? And then I want to discuss how providers are or are not educated in giving this type of information, and then realistic data. What's the success rate, how many eggs need to be frozen, and etc. So the first is education of women. There is definitely a misperceptions about fertility postponement. Most women are not sure at what age infertility becomes an issue or fertility starts to decline. And it's really not until themselves experience fertility issues that they start to be aware of the problem. And furthermore, there is a persistent misperceptions that once they get the problem, regardless of the age, they can go to a reproductive endocrinology service, to a clinic, to a doctor, and ART can fix the problem, can fix what we called in this publication an aged biological clock, which is not true. And then the media also does a disservice to women because by putting on the first page of their magazines pictures of actresses and models that they have pregnancies at a late age without really, for HIPAA reason or other reason, not revealing the identity, the source of the oocyte to create that pregnancy, make women to believe that a good fertility doctor can indeed fix and give them a pregnancy, even if they are 45, 46, 47, or older. To further make the problem worse, the social fertility preservation has also seen some interest from companies such as Apple, Facebook, lately also Intel, that they are starting to offer the service of egg freezing to their female employees, and therefore there is a kind of a rush. There is a social push towards going into freezing eggs as a panacea, as a method to really preserve forever your reproductive opportunities, which of course is not correct, as you will see in the rest of the talk. So the first question that we want to answer now is, okay, why do women freeze? And this is a study that has been carried out by Professor Marsha Einhorn, professor of anthropology at Yale. I am the co-PI on these studies, and so in collaboration with Norbert Gleicher here in New York, with Joby Doyle at Shady Grove, and Lynn Westphal at the University of California in Stanford. What we did here, we really asked women that froze their eggs, why did they do it? First of all, who are these women? Women are highly educated, Ivy Leaguers, other elite universities, mostly with graduate degrees, that they went to go and freeze eggs. Great majority single. The samples is about 200 women that they participated in the survey. 62% single, 21 partnered, 10% married, and 7% divorced. What are the findings? Well, the main finding is that elective egg freezing is not being done by women that are in career and they want to postpone their fertility as it is assumed, or as it was assumed. Women are freezing because they are single and they cannot find a partner. So then this bears the next question, which is why there are so many high-achieving, smart, articulate women that they cannot find a husband, at least in the United States.
Be nice.
So then, what were the main laments, the main complaints when they were answering the survey, interviewing face-to-face or on Skype with Marsha? They were saying, well, you know, probably the possibilities here is that because we are so smart and so educated, so confident, there is probably a kind of an intimidation for the men, the so-called demasculination thesis. So they don't feel that they are the machos, that they are going to be taking care of us, and blah, 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 blah. Second, high-achieving women, they only want to marry with high-achieving men, and thus they narrow these options. That's the alpha male thesis. Also complaining, with women away, complaining that many men, they delay marriages, they delay their commitment, and they never grow up. That's the so-called Peter Pan thesis. Women, this is a reality from the survey, the women marry up while men marry down. Okay? So then is the thesis of the missing men. You know, how many men can be at the same level of a woman that is smart, articulated, is a CEO of a company or a lawyer or medical doctor, if they only want to marry at the same level? And then online dating is creating a limitless marketplace of options, but this is especially for men, not so much for women. Now, there are this data that have been collected. They are also confirmed by some sociological research. This is John Berger on a date-onomics, how dating has become now a loop-sided number. In other words, this is a potential demographic time bomb in the way that I'm going to explain to you, is that there are women that are graduating from colleges in the United States at a greater number than men. There are 4 women graduating every 3 men in the United States. And the estimate is that by 2023, female grads will outnumber male grads in about almost 50% of them. So this men deficit and oversupply of intelligent women is really called the demographic time bomb. and especially for marriage-minded heterosexual women. So classism is bigger than racism in dating. In other words, women will not marry down. And who is in trouble? Both high-achieving women that are at the top, but also men that are at the bottom, the blue-collar men, because nobody will marry them, and there is nobody to marry the women that are on the top. So this is really a demographic time bomb. So how is egg freezing fits in this context? What do they freeze? Well, this is really a kind of a concession to this gender imbalance. They see egg freezing as a stopgap, a way to at least buy some time, a way to prevent desperation marriages. So all these quotes are all expressions that have been used by these women. 200 of them, they have frozen eggs. So a way to preserve fertility following a bad breakup, divorced, dumped, or duped, as a relief of sadness, shame, loneliness, and stigma. So here you have the sociological reason why, from this analysis, women are freezing eggs. So where are they getting their information? Providers. When you ask them who gave you the information, they go to the primary care providers, and OBGYN are considered their primary care provider. But so then we ask the question, do OBGYN know about it, egg freezing? And this analysis that I'm going to show was stimulated by the publication of this book by Tanya Selvaratnam, which is a producer of Broadway shows and is an activist, feminist. That's on her own story. She was so upset with OBGYN that told them, no, don't worry about it. You are 37, you had the first miscarriage. No, keep going. At age 39, she got the second miscarriages, and they still said, oh, don't worry about it. You still have time. And then at age 41, she also got another pregnancy. Finally, they did the workup. Then they discovered that she had some serious issues. And then by age 42, her AMH became undetectable, and now she's childless. And she's really upset. She wrote this book, The Big Lie, on how OBGYN were so misinformed that she felt betrayed by the class of doctors, of course. So then we did a study, and Dr. Yu, a senior resident at Yale, now she's an attending in California, we said, you know what, let's ask the OBGYN resident in the United States, what do they know about egg freezing, and for what reason should be done? So we did a survey. This survey was first tried and tested at the Chapman University School in California to see if it was really an effective survey. And then we sent it to the CRIOG director of a residency program in the United States. So these are the results. So 239 OBGYN residents responded, and that's broken by age. And you see that overwhelmingly, the OBGYN resident in the United States, they think that the OBGYN should start the discussion about potential childbearing with their patient. They also are overwhelmingly convinced that this discussion should also entertain the topic of age, decline, fertility. Okay? Yes, sure. We need to talk about potential childbearing plan. We should talk about the marked decrease of fertility. We should talk about this. Okay? And then look, what do they know? When is marked decrease of infertility or marked decrease of women's ability to become pregnant kick in? And you see that these are first-year residents. For them, 51% of them, they thought that the marked decrease in chance of pregnancy is between age 40 to 44, when in reality it's earlier, it's 35 to 39. The second year, 38%. The fourth year, 41%. And the fourth year, 56% of them, they were wrong. Now, this was just to start the discussion. Now, so the next question is, would you recommend egg freezing? Look at the answer here. The answer here is very interesting, that they will definitely recommend, very likely or likely, to do egg freezing if it's for a cancer diagnosis. In other words, a medical diagnosis, absolutely. But if it is for elective reason, for future fertility preservation, social reason, the great majority, they say no. Or particularly younger than 25 or more, they say, unlikely, very unlikely, somehow likely. Okay? So why? Well, the reason why is because they feel uncomfortable to talk about elective oocyte banking because they feel like, in their explanation, because we don't want to push a pregnancy too early. It's okay to talk about the birth control pill. It's okay to talk about age-related fertility decline. But if someone asks about egg freezing for social reason, we are not so comfortable in talking about. But for us, what was worrisome, and hopefully the director of residency program took note of this article, is that many OBGYN, they are not familiar with the concept of age-related fertility decline. And therefore, this has to be changed, okay? So there is a need for more education. Now, what about the data? I got slides from Antonio Pellicer and Anna Cobo from EVI. They are the world expert in egg freezing by vitrification. And I requested the data on social freezing. And you can see here that in Spain, the number of social fertility preservation has been going steadily up since the year 2011. And these are, however, the number, percent-wise, of the fertility preservation for social reason, which is about 20%. The great majority of vitrification are still for creating egg banks. So almost 75% of their business is egg bank for donors. But they do have about 25% that has been going on for either medical reason, 5%, or 20% for social reason. And if you remember the data from our survey, the sexual orientation and marital status is exactly the same. Educational level for fertility preservation exactly the same. So even in Europe, and Spain in particular, highly educated women are undergoing social fertility preservation. And the same phenomenon that is in the United States is also in Spain, which is at what age are they going to the doctor to freeze their eggs? It's when it's probably already a little bit late. 37, 38, 39, and 40 in this bell-shaped distribution of age, with the mean age of freezing, which is about 37 plus minus 3. And the same late freezing time is in this other paper from Mitchell-Wolf, Germany and Switzerland, saying that the great majority of women that are freezing are in between the age of 35 to 39. Now, are they using, how many eggs are they freezing, and how much has been used so far? So as an average at the EV clinic for fertility preservation, you see that the mean number of eggs that is frozen up to the age of 35 is about 10 to 11. Then 9, 36 to 40, and 5 over the age of 40. And these are the ones that are vitrified. So that's collection, and that's vitrification. So a woman that is 40 years old or older, she probably can count for each cycle about 4 eggs vitrified, 36 to 40 per cycle, about 6 eggs. Now, what about using them? Overall, there is a very low usage rate in the United States, but also in Europe. And you see here that so far, even though they start to do fertility preservation for social reasons now for the last 6 years, the number of patients that has returned to use their frozen eggs is very small. It's only 9%, as I listed to you here. So 123 patients came back. And the one that are using, the age they came back the most are the women between age 36 and 40. What is the success rate? If you read this paper that came out a couple of months ago, you are led to believe that all women should freeze their eggs. And this is a paper from Ana Cobo and Juan Garcia Velasco. And you see here the success rate. Let's analyze this table here. So if you look at clinical outcome according to the age of vitrification here, the data seems to be pretty comfortable for women that are younger than 35. The ongoing pregnancy rate per cycle once they use their eggs is 51%. But older than 36, it drops to 18%. And then they subdivided this older than 36 into the bracket of 35 to 39. And here I want to point out to you that this is the largest number that use their eggs, 127 patients. And look at the success rate, 21%. And I think, and you will not disagree with me, that if we offer a 20% chance of an ongoing pregnancy rate when we use fresh eggs to this patient group, 35 to 39, patients will not be very happy, and we will not have a good claim of saying that we are doing a good job for them. So 25%, 24%, actually in 21%, it's not, in my opinion, a good number for ongoing pregnancy rate per cycle. Then we did a very recent review, I think it was last month that came out, by looking at the Italian experience. See whether the Italians know better. And here the key points of this paper, by reviewing a number of years of egg freezing done in Italy, is that vitrification is better than slow freezing. So this should be a closed chapter, at least consensus. Vitrification better than slow freezing. The outcome of vitrified warmed oocyte are still inferior to those that utilize fresh eggs, unequivocally. Year after year, I will show you. And most importantly, experience makes the big difference. In fact, there are great variations among the centers that they report their data to the Italian collection system of IRT, reflecting a steep learning curve in how to do oocyte vitrification, and perhaps the results that are obtained in few hands, Spain or in the United States, some other, that they are really good at doing that because they do a lot of cycles. They are probably there is a need of standardization of the processes. And not everyone can do 10 cycles and say that they have, quote, the same success rate of people that are with more experience. And here is the result from some of this experience from the Italians. You see that year after year, the result of pregnancy per started cycle with vitrified oocyte was much less than if you use fresh oocyte. These are across all the ages, okay? And also the pregnancy rate per transfer, if you don't want to use the intent to treat, still vitrification of oocyte is much less than when you use fresh oocyte. And these are the cutoff on how many cycles a clinic should do in terms of cryopreservation cycles in order to become competent. At least for Italy, the number of cycles, certainly more than 200, and the best is when a clinic does more than 500 cycles, that their vitrification rate with oocyte, it becomes much better than if you do less than 200 cycles. And this is not a surprise. There was also a confirmation, I believe, from Dr. Kushner, first name, or Norbert, I don't remember who was the first name on this paper, showing that if you look at the United States SART for egg donation cycles by using fresh versus frozen eggs, there is a significantly worse outcome with the use of frozen eggs than not if you use fresh egg in live birth per recipient start, live birth per embryo transfer, on whether you use fresh, which is better, or you use cryopreserved donor oocytes. So to the question, how many eggs should we tell a patient to freeze, I percolated through the literature and I came up with this number in that it depends on the age, at which the woman freezes and on desired number of children. If it's a woman that is freezing at the age younger than 35, maybe freezing 10 or 20 oocyte, but in 2 cycles, that should be probably okay to have a safeguarded chance for 1 or 2 children. If she's 35 to 38 at the age at which she freezes, 20 to 25 oocyte, still in 2 cycles, not only 1 cycle. So you do 1 cycle, 10, 12, and another cycle for another 10, 12. And if it's a woman that is older than 38, then you probably need, for having 1 child, you need to have 20 to 30 eggs in 2 or 3 cycles. And the last will be the fertility preservation in transgender body changes, which are becoming more and more common, or at least in our consultation schedule, to have this type of request. Now, how many transgender are in the United States? It's not sure. That's why there's a question mark there. A publication from the Williams Institute in California in 2011 was estimating that 0.3% of the adult population in the United States may be transgender, so it's about 700,000 individuals. But we cannot be discriminant. So the World Professional Association for Transgender, the WPATH, emphasized the needs to discuss fertility preservation options. And also the Endocrine Society and the American Society of Reproductive Medicine support counseling and offering services of fertility preservation for transgender individuals. And when there was a survey on transgender men, more than the great majority of them showed that they really want to preserve the opportunity to have their own gametic, genetic children. And that's the committee opinion of the American Society of Reproductive Medicine, saying that every request should be treated with dignity, we should respect, no discrimination, and so forth. Obviously, there are some ethical concerns that they need to be addressed when you offer this type of service. And what is important to discuss is the unconventional outcome. So they need to be mentally prepared that the day that they will come and they want to use their own gametes, that they were frozen prior to have the body change its operation, there is going to be the situation of gametic mothers and fathers, but reversal parental identities. And so this has to be discussed, not to close the offering of the fertility preservation, but they need to understand if you are a boy and you want to become a girl, and I'm freezing your sperm, when you are going to use it, now you changed your body to a female, you are going to be seen as a mother perhaps in that relationship, but we are using your sperm. So you are a gametic fathers, but you are a parental mother. And this is a Time magazine in 2016, which showed the report of this reporter who says, my brother Ivan was born as a female. So that's why here you see breastfeeding the first child, because she retained her breast and her uterus. And when he became a he, you see here the beard using testosterone supplementation. But then he wanted to become a mother and therefore stopped the assumption of steroids, became a mother, and then started to do also some breastfeeding. And this spring gave birth to his first child. So in summary, after the candid assessment of oocyte cryopreservation for elective reasons, or fertility for social reasons, we can say that yes, egg freezing is a powerful technology. However, women need to be informed by their OBGYN, and we need to inform and prepare the OBGYN on this type of requests. If they decide for elective freezing, fertility preservation for social reasons, perhaps better, sooner the better. Don't wait until 39 or 40, because if you freeze an egg at age 39 or 40, you are not rejuvenating the eggs just by putting it in liquid nitrogen. You are just safeguarding your chance of success according to the age at which you freeze your eggs, and maybe even decreasing that chance if you were going to be using fresh eggs. That has to be made very clear. Also has to be made very clear at the consultation time that they may be freezing eggs, that they may be never used. And also has to be made clear that the success rate with the fresh eggs is always better, at least for now, than frozen eggs. But also has to be made very clear, and this paper also came out a month ago, that you may need to do more than one cycle to freeze a number of eggs that is sufficient to guarantee you a chance for one or two children. You also need to make very clear the cost, not only to do the process of freezing, but also the cost to keep the eggs frozen for a number of years, and the cost of when you are ready to use those eggs, because you need to do ICSI, most likely, on those eggs that survive the warming process. And also has to be made very clear, there is always a risk that at the end of all of it, the procedure may not work. You waited until age 40 because there are no men or whatever reason, but at the end you may have no baby. So this has to be all very well spelled out. Don't give false illusions. I'm against those egg martini parties. I don't know if you're familiar in the United States what they do. There are companies that are middlemen. They want to bring patients to the clinic to freeze their eggs. They offer martini in posh hotels here in New York. And they want them to sign a consent after one or two glasses of martini saying, oh, if you come with me and you go to this clinic, you get $500 discount. So that's ridiculous. Once all of this is made clear, I think that we can be feeling that we have done our job. Thank you so much for your attention.